Hi, I'm Dr. Jade Reynolds, and welcome to my office here in Berne, Indiana.
I really appreciate the atmosphere of this office. It's always very pleasant. I appreciate Dr. Reynolds because he has a very, very friendly manner. He has a very caring manner.
You're going into an office where Dr. Reynolds is a graduate of a major school, and he knows and has learned the latest techniques.
I do kind of the standard as far as like what we call diversified, which is more the hands-on where you push or snaps or pops or cracks. I also do what's called the activator technique, and that involves a little instrument called the activator instrument, and it'll do a little thump. It has different force settings. It's pretty painless. It's real easy on the patient. If you look at the spine here, we can do it here, and you just get real specific on the area you want, and you can change your line of drive and give it a little thrust. That puts it back in place. I go one by how the patient prefers, because some patients do not like the cracking or to hear their neck snap or crack. So that's why we do the activator. But I also sometimes, I see that, oh, the activator's not working, or adjusting manually with diversified isn't working. So sometimes I change to a different technique. So that's why you learn more than one technique, so you have the advantage to help as many patients as possible, because one technique doesn't fit everyone. You get to interact with a lot of older patients, more mature patients. Also get to interact with a lot of high schoolers or middle schoolers from the school, because we deal with a lot of sports injuries. Also deal with a lot of kids and babies, because the Amish like to bring their kids in and get them treated. Generally, the patient will come in, we'll do the exam, a new patient exam, and then sometimes we do some therapy, which could be electrical stimulation, which helps relax the muscles. I do trigger point therapy, which is another way of trying to relax the muscles or release them. Also do ultrasound therapy, and we also use what's called a therapeutic laser, and that sends red light into the cells, and it helps speed the healing. But a typical patient is going to get the exam. They all get what's called the vibratory massage or the genie rub, and most people love that, and we try to give them the best value for their money. I think there's more to being a doctor than just, coming in, treating the patient, sending them on their way.
You know that he's going to serve you well because it comes across that he cares about your difficulty, or just cares about you.
He's not going to hurt you. He's there to help you, and that's why I would suggest that you come.
Call today for your appointment. Our phone number is 260-589-3256.